sometimes phoning the vets, they'll ask you a few questions, and the more information you can give them, the better. So if you come home and your dog is laying on the floor, not necessarily wanting a tummy tickle, but you're concerned that they're not well because they're not bright and they haven't greeted you in the same way, what can you check for at home? The most important thing is to stand back and see how they're breathing. And you can count their breathing rate over a minute, and that's really good information for a vet, because if their breathing rate is a lot faster, then it may indicate that they're in pain or they have respiratory problems, and they probably need to be seen sooner rather than later. So we look at the breathing rate and the rhythm. Does it look like their tummy is going in and out as they breathe? Because again, that can indicate an abnormality. So Bessie here is breathing relatively slowly, apart from when she's sniffing, and her tummy is nice and relaxed as she's breathing. The other thing that you can check for is the gum colour. Now, even in dogs with pigmented membranes, there are normally some areas where you will see pink. And the colour that you're looking for is a pale pink colour. And if you squeeze the gum, you'll blanch it, and you can count the number of seconds until the colour comes back. And that indicates how well the blood is flowing. If the gums are very pale, or it's taking a long time for the colour to come back, again that can indicate a problem. The other thing you can do at home is you can see whether or not there's any pain in the abdomen. And just very gently put one hand underneath and press down gently and see if the dog really doesn't like it. Again, that could indicate an abdominal problem. Finally, a good thing that you can check at home is the pulse. Now, don't be alarmed if you can't feel this, because vets and vet nurses train for quite a while to be able to reliably feel a pulse. But if you put your hand right in the groin, you should be able to feel a pulse under your fingers. Make sure you're not feeling with your thumb, because sometimes you can feel your own pulse in your thumb. But if you just put a flat hand into the groin and then count the number of beats that you feel over a minute, again, that can give some very useful information and will help to guide the vet whether or not they need to see your animal out of hours, or whether or not it's something that could maybe wait until the morning.